Okay, wash my hands. Hi Bailey, my name is Corey. I'm an FNP student. I'll be taking care of you today. Are you okay? So we're just going to be doing an abdominal exam. Are you okay if I record this exam and then post on YouTube for my class?
Yes.
Awesome.
That's fine.
Okay, thank you. Go ahead and pull your shirt up for me so I can see the abdomen. So first I'm just going to be inspecting the abdomen. It's nice and flat, not rounded. No peristalsis noted. And then the sclera of the eyes are white. The skin color is not yellowed at all. So that looks good. And then I'm going to, and I don't notice any scarring or any lesions or anything like that. So first I'm just gonna listen to your bowel sounds in all four quadrants with the diaphragm. Okay, awesome. So all four quadrants are normal active, which means you've got normal bowel sounds. So I'm just going to listen now to your femoral artery for bruise with the bell. With that?
Not the femoral artery.
Did I say femoral?
Yeah.
I'm sorry, the aorta. And then the renal artery. Yeah, renal arteries. Now I'm second guessing myself.
You got it.
And then iliac arteries where they branch off just above the belly button. On both sides. Okay, and then we'll listen to your femoral arteries. Awesome. I use the bell just because it can pick up more low-pitched sounds. I didn't notice any bruise, which is great. And then next I'm going to be doing percussion, where I just kind of tap on your stomach, sort of. So I'm going to go in all four quadrants. Okay, I definitely notice tympani, and that's a good thing. And then I'm going to start to go up, and I'm going to find your liver border. So I'm just going to start low, kind of mid-costal line. Right about there. Then I'm going to come down from down here. Okay, awesome. So right about there to right just towards the edge of your liver. I'd say you're about 6.5 centimeters, which is normal. And then I'm going to also percuss for the spleen. Right there, you've got your spleen. Both over the spleen and over the liver is going to be dull because it's a solid mass. I'm going to also percuss over your bladder. And it's mostly tympani, which is the same as the rest of your abdomen. If your bladder were full, it would be more of a dull sound, so you must have just recently emptied your bladder.
I did.
Okay, awesome. So that's all I'm going to do for the percussion. Next, I'm going to do just a light palpation, just to kind of feel for any surface masses or anything. Is that painful at all or uncomfortable?
Not at all.
Okay, I'm going to go a little bit deeper, feel for any masses. Is that uncomfortable or painful?
No.
Okay, awesome. Now I'm going to feel for your liver and just palpating like this. I can't quite feel it, so I'm going to hook my fingers under here. Okay, take a big deep breath. And that liver bumps right into my fingers. Okay, go ahead and relax. Now I'm going to feel for your spleen, and I can't feel for your spleen at all, which is a good thing. And then I'm going to perform a couple tests. One of them is called the Murphy's sign. So I'm going to push right here, take a big deep breath in. Okay, awesome. Any pain when you breathe in?
No pain.
Okay, so that's a negative Murphy's sign. Positive would be if it is causing pain, or the pain causes your inspirations to stop. That would be potentially cholecystitis or something going on with your gallbladder, or maybe even liver pain. And then the next one I'm going to do is going to test your appendix. It's called McBurney's point. So I'm going to push in right here on the right side and let go. Any pain with either of those?
No.
Okay, so it's a negative McBurney's point. That would be, positive would be if it's pain when you're taking the fingers off of the stomach quickly, just that rebound tenderness. So that's good. So that's all of the palpation. So, oh, one more thing I'm going to do is it's called a fluid wave test. Obviously, this patient doesn't have any ascites, but for just to show the test, I'll have you use your hand and put it just directly down the middle, and then you would just go like that and notice any fluid shift. You can also percuss. You're good now. You can also percuss down until you feel more of a dull, or you hear more of a dull sound. That could be the fluid shifting, and then you could roll them to one side, percuss, and then that fluid would be shifted more. It would be different placement on the abdomen because of the way that they're turned. Okay, then the last thing, go ahead and put your shirt down. And then I'm just gonna check for, it's called CVA tenderness, it's for your kidneys. So the first one I'm gonna do is indirect. Any pain on either of those?
No pain.
Okay, and then I'll do direct. Any pain on either of those?
No.
Awesome, okay, we are all done. Thanks, Bailey.
Thank you.